Well, thank you, both of you, for making it. We're live now, and we've got a fair number of people attending this new health webinar hosted by our company, New Zealand Shores Immigration Consultants. My name is Fabian Maisonneuve. I'm a licensed advisor at New Zealand Shores, and today as panelists we have Prudence Thompson from Accent Health Recruitment, and we have Charlotte Stockman as well, who is my colleague and licensed advisor. Do you guys want to introduce yourself briefly? Prudence?
Yeah, hi, I'm Prudence Thompson, based here in Christchurch, New Zealand. It's 9 o'clock on Monday morning. We've got a short week this week with Easter coming up. I'm a nurse originally by background. I've been recruiting for 24 years, which ages me a little bit. And we are, as I said, here in New Zealand and looking forward to talking to everyone and answering the questions.
Cool. Thanks, Prudence. Charlotte?
I am Charlotte. I am a licensed advisor here at New Zealand Shores. I've been a licensed advisor for 6 years, so have been doing this for a little while now and helping a lot of healthcare workers successfully migrate for the last 12 months while our border's been highly restricted.
Awesome. Cool. Just a little bit of housekeeping. I see some questions popping there in the chat. Are we able to get a recording afterwards? Yes, everyone who's registered for the webinar will be getting a recording afterwards. Other question, another thing, yes, if you can please put your questions in the chat, in the Q&A rather than the chat, so that we can address these as well. Sweet. Okay, fantastic. Now, I'm going to turn to Prudence first. It's already been 5 months since we did the last webinar for health professionals wanting to move to New Zealand. And I'd love to hear your thoughts, Prudence, about what's been happening over the last 5 months. Have you been able to assist many people? What's the process like from a recruitment perspective? What's the job market like? What's been the impact of COVID on the job market as well? And then I'll be asking the same thing to Charlotte from an immigration perspective.
Thanks, Fabian. Yeah, look, I mean, as I said, I've been recruiting for 24 years. The last year has certainly sent us a lot of challenges and a lot of curveballs. Interestingly, it's actually a silver lining, COVID, and I hate to describe it like that, but because we need more vaccinators, GPs are busier and the medical professionals are retiring, and there's a higher incidence of certain diseases in New Zealand like cancers and heart disease that wasn't addressed 12 months ago. Now we need more health professionals. So we need doctors such as psychiatrists, GPs, all specialists. We need registered nurses. We need theatre technicians, ODPs, midwives, physios, OTs, allied health, sonographers, anyone who works in a hospital we recruit. Myself and Hayley were originally registered nurses. Don't ask us to change addressing because I'm certainly a bit rusty, having been recruiting for so long. But the impact of COVID has certainly not slowed anything down. We're getting the visas and job offers very quickly. It takes anywhere between 2 days, 2 weeks to get a job offer in writing after interview, and we're recruiting for the whole of New Zealand. So that's New Zealand Sign Language, and that's the North Island and the South Island, being Auckland, Wellington, the Marlborough region, Christchurch, Southland. So we recruit all of New Zealand, and at the moment, the private and the public hospitals are asking us to find staff. So there are vacancies, there are opportunities in New Zealand. The first and most important challenge is to get your registration. So getting registration, and we can talk you through that. Once you have your registration, you have a video interview, which is as much fun as presenting on Zoom. And once you have your interview, you'll get offered the job. And then the process for the visa that Charlotte will talk about takes anywhere between 2 and 20 days to get a visa. And Charlotte can back me up on that. But the process to get a visa is pretty quick once you've got your registration and job offer. Securing managed isolation is not a problem now, especially if you're a medical professional. We can look at finding managed isolation for you as an emergency, but at the moment there's actually quite a few vacancies within managed isolation, which we're really, really happy about. So the process is really easy. Health professionals are welcomed into New Zealand, And New Zealand does actually need 2,000 vaccinators in the next 12 to 18 months. So those nurses have to come from somewhere. And GPs are very, very sought after, psychiatry, mental health. Yeah, and we'd love to help you. We're a free service, so we don't charge for our recruitment services. The hospital contract us to help find you.
Fantastic. Thank you, Prudence. You did mention something about the interview. I remember we recorded something about interviewing for a job in New Zealand. So if anyone wants to find out more about the techniques and see some examples of what you should or you shouldn't say, the kind of question you can expect, you can find these on the New Zealand Shores YouTube channel. There is a recording there about interviewing in New Zealand. Now, Charlotte, what's your experience of the last, say 5-6 months not recording, but assisting people with migration matters coming into New Zealand?
We have seen everyone from nurses, midwives, doctors, psychologists, psychiatrists, pretty much every medical profession that you can name, I have done a visa for in the last 6 to 12 months. So it's been a really busy period for us. And we've been working really closely with Prudence and her team at Accent Health. So I know more about healthcare workers now than I did a year ago, and a lot more about the registration process. So it's been a big learning curve for us as well as advisors. And of course, the visa process has changed. So we've gone from some people arriving in the country before they even have job offers to do job search trips, to really needing their registration and their job tied up before they can even apply for a visa. So the process now basically is you have to apply for a border exemption request once you've had that job offer and you've got your registration. To then, once that's approved, we then apply for a critical purpose visitor visa, which then facilitates entry to New Zealand. And then once you're on shore, we apply for what I'm calling your normal or your real visas, which are the ones that facilitate you to stay in New Zealand for a longer period of time. And what those visas are, we will talk about those a bit more in depth, but they ultimately depend on your occupation and your employer. So yeah, it's been a busy time. Wouldn't say it's been easy learning the process, but now that we're really familiar with it, we're very comfortable. And yeah, it takes about, I would say, anywhere between 1 to 3 weeks in total between the border exemption request and the critical purpose visitor visa being approved.
Right, thank you. I see a question that's very highly relevant there in the Q&A. What is managed isolation? I suppose we should have, started with the basics, really. New Zealand's borders have been severely restricted for about a year, and everyone wanting to enter the country, if they are eligible, need to first request a border exemption, and then through that, depending on their status, they can get a certain type of visa. But on arrival, everyone, no exceptions, will have to spend 14 days, 2 weeks in managed isolation, which essentially is just another name for quarantine. So that answers that. Prudence, another question there. You talked about the need for 2,000 vaccinators. Vivian's asking whether doctors can be hired as vaccinators too, or is it solely for nurses?
Thanks, Fabian. Yes, we have been asked a lot about vaccinators and getting a job as a vaccinator. At this stage, they're using New Zealand-based nurses who have done the New Zealand-based vaccination course. But whilst these nurses go off and do the vaccination course, it does create vacancies within the district health boards or in primary care. So these roles may or may not be appropriate, but we'd love to review your CV, and you can send it to info@accent.net.nz. So we'd be happy to review your CV and look at opportunities for you. We never say never.
Cool, thank you. Now we have a short presentation to go through the process. Charlotte's going to be running that show, and then we'll ask you to participate at some point, Prudence. Sweet. Can everyone see the presentation there?
Sure can.
Right, fantastic. So health workers wanted in New Zealand. We're going to go through the border restrictions, the critical purpose visa, and then the longer term visa pathways once you're actually in New Zealand with your family. So over to you, Charlotte.
Awesome. So we have talked a lot about already how the New Zealand border is highly restricted, but effectively everyone in this webinar, as long as you are a healthcare worker, the border is very much open. So we've had, oh gosh, don't know, dozens, Prudence probably had hundreds of people arrive in the last 12 months since the border formally closed. So yeah, the border restrictions effectively don't apply to you. There are basically, I guess, 3 steps to the process and how you can map out your migration. So one will be occupational registration. Most healthcare, well, I think all healthcare workers require an occupational registration to be able to work in New Zealand. And that really is Accent's specialty, not ours. So whilst we're learning, they are definitely the gurus on that one at the moment. There's also documentation. So that's from both a employment and recruitment perspective and an immigration perspective. So obviously each process has its different documentation. Some may cross over, for example, work experience references, but Prudence can guide you through, or Prudence and her team can guide you through the documentation for the recruitment process and securing a job, and we can guide you through the documentation required for the immigration process. And there is also job search strategies. So once again, Accent's field of expertise, but ultimately you need to have a job offer before you can migrate. So we can't go about applying for border exemptions or critical purpose visitor visas until you've got that job and your occupational registration. So 2 very crucial steps in the whole process. But yeah, obviously you can work with both us and Accent to really, facilitate both of those things. So we work together as well as a team. So yeah, I've already talked about those different visa types, but basically the border exemption process at the moment is that 1, you need to get that skilled job offer. So that's the first step. Then we submit what's called an expression of interest, or an EOI for short, and that is an expression of interest to come to New Zealand as a healthcare worker. We normally refer to it as a border exemption request because that's kind of the easier way to explain it to most people. And what that is a short form about you and your family. We submit those details along with details of your job offer, and immigration will review that information and say, okay, great. We then invite you to apply for a critical purpose visa. So technically someone could fraudulently say they're a healthcare worker, but when they actually apply for their critical purpose visa and don't fall into the right criteria, it could get declined. So obviously we check that all right from the outset. Once you've been invited to apply for your critical purpose visa, it's effectively a visitor visa application. So it has less documentation attached to it than what a work visa does. But a lot of the documentation we use in that critical purpose visa actually crosses over with your work visa when you arrive.
I'll jump in there for a second, Charlotte, because we have that question quite a few times in the Q&A. Can I bring my family with me along as part of that critical purpose visa? Yes, absolutely. Yeah. You can include your partner and dependent children in that critical purpose visa application, and you do not have to be married. A long-term relationship is definitely valid. We just need to prove that the relationship is genuine, likely to endure, and you have been living together. Another question we have is same-sex relationships are definitely recognized in New Zealand. There's also no issue there.
Yeah, I will just add to that. So in terms of bringing family with you, at this point, because of the way the border is, it is actually really important that everyone travels together. Sorry, excuse me. If you don't travel together, there is, at this point, no pathway for your family to join you later. So we understand that the government is actively working on opening up the border a little bit to partners and dependent children of workers if they want to travel separately. But at the moment, really, it's highly important that everyone travels together. So yeah, 1 application for the border exemption or expression of interest, and then 1 application for the critical purpose visitor visa. Then, like Fabian said, on arrival, you have to go into managed isolation or quarantine, and that is, you're told as you're flying into New Zealand which hotel you'll be isolating at. 2-week hotel stay, and they have selected mostly 4- and 5-star hotels, so it could definitely be worse. Once you do arrive into New Zealand, we jump into applying for what I call your real or your normal visas. And these are work visas for the principal applicant, so the person who has a job offer, and a work visa for their partner, and their children either get student visas or visitor visas, depending on how old they are. Student visas.
If it wasn't for COVID, that's what we would have applied for in the first place, isn't it?
Yeah, absolutely. So we had no border restrictions, and if it wasn't for COVID, the slide that you see now would be step one. We wouldn't have those other two steps. They did not exist prior to the border becoming restricted. So there are, at the moment, there are two types of work visas. There is what's called an essential skills work visa, which I would say probably 90% of clients end up applying for. And then there's also a talent work visa, and that has two strands attached to it. So there's the long-term skill shortage list, which some medical professionals are listed on. And then there's also what's called accredited employers. So a lot of our district health boards and hospitals are accredited employers, but not all of them are. So if you secured employment with an accredited employer who, and you met the criteria for that visa, or if you were on the long-term skill shortage list, then we would apply for that talent work visa. It's granted for a total of 30 months and actually provides you with a second pathway through to residence. If you didn't meet either of those criteria, then we apply for the essential skills work visa, and that is granted for 36 months. And that it doesn't technically provide a pathway to residence directly, but you can apply for residence under the skilled migrant category. Which is what we come to here. So there are two main categories for people applying for residence in New Zealand on the basis of skilled employment. One is the skilled migrant residence category, which I would think probably, at least 90% of my clients apply under. And then there's also the talent residence. Talent residence requires you to work on that long-term skills shortage list visa or accredited employer visa for 24 months before you can apply. So we get quite a number of people such as healthcare workers who technically are eligible under that talent pathway, but will actually apply under the skilled migrant residence category, because you can have residence within generally about 6 months as opposed to waiting for that 24. But yeah, everyone does it differently. Some people will quite happily wait the 24 months and apply under the talent residence.
Now, a few words about the skilled migrant category. Like other visa categories, this was paused as a result of COVID restrictions. It's a two-step process whereby you initially submit an expression of interest, where you explain how you meet the points tally, and then you get invited to apply for residence when you submit all your paper-based documentation. And then it goes into a queue until a case officer picks it up and processes it. So the EUI pool is currently open. It has never closed, but it's the fortnightly selection of those applications that has been on hold for just about a year, I believe. We have information from the government that they are looking at reopening it in the next few weeks. Nothing set in stone, but it's being discussed with the Minister of Immigration as we speak. Now, if you apply for residence under the skilled migrant category, it could take anywhere from a few weeks to well over a year, but there is a prioritized pathway. If you hold any kind of occupational registration, so that could be doctors, nurses, or if you earn a high salary, your application could actually process within a month. There's virtually no queue for the fast track pathway, as we call it. Now, upcoming policy changes, that's something that a lot of our viewers would have questions about. Would you like to say a few words about this, Charlotte?
I will say as much as I can. So yes, the New Zealand government has announced that there will be policy changes. So we have known about these since basically, gosh, I think it was end of 2019 they were announced. They were due to come into effect middle of last year, but obviously with COVID and everything that had to get up and running with immigration in terms of all these new processes to get into the country, it was put on the back burner. So the new rollout date is anticipated to be sometime in the middle of the year, but from what we've heard from our relationship manager at Immigration New Zealand, they're probably going to miss that deadline, and it's likely to be in the last quarter of the year. But at this point, we're kind of still going on what the government said with their official announcement. Those two visas that we've talked about in terms of the essential skills work visa and the talent pathway, they're no longer going to exist. So there will be 6 employer-assisted work visa categories that are turned into one type of work visa. You will still be able to apply for a work visa. The ability to apply for a work visa is not going to go away. All it means is that it's going to have a different name, and there will be probably one set of policy. So ultimately for you as a migrant, it actually makes things a whole lot more straightforward. You're not having to worry about visa types. There will just be one, and you're all skilled, highly skilled professionals. So whilst the name might change, your ability to migrate doesn't. So just keep that in mind, that whilst policy changes always sound scary, they're not going to really have any impact on you other than the name of the visa. The minimum salary threshold for a work visa will become $27 per hour. Once again, something not really any of you are going to have to worry about. You would all be paid well above this. So we're not too worried for a lot of our highly skilled clients. The work to residence pathway will remain open to people on this work visa if they're earning twice the median wage. So that based on $27 per hour works out to about $112,000 per year in New Zealand. But once again, we haven't actually seen the policy. It hasn't been released to us yet. So a lot of this stuff is just based on the minimum information that the government's released. There's also been no change announced to the skilled migrant residence category. So even if you get this new work visa, you will still have a pathway always to apply for residence under the skilled migrant category.
And that's the end. Fantastic. Thanks a lot, Charlotte.
Thanks for bearing with me through my coughing.
Awesome. Right, quite a few very relevant questions there. One for you, Prudence. Someone who's already a COVID-19 vaccinator, how easy would it be for them to secure a job?
Look, I'd have to look at the CV before giving it a definitive answer. At the moment, they're employing New Zealanders to do the COVID vaccinations because they're on the ground. Because these vaccination nurses will be short-term placements, there is possibly a requirement that we might have to look offshore. However, by the time you go through the process, get your registration, go through quarantine and arrive, that's probably a month's work, and the contracts may only be 6 months. So I'd encourage this person to contact us to look at other opportunities as well as vaccinating.
Cool, thank you. Talking of opportunities, can we do a quick yes/no regarding the demand there might be for several strains of health professionals? Prudence, is there demand for registered nurses?
Yes.
Palliative care physicians?
Yes, yes, very much so.
Psychiatrists?
Yes, yes. Kristen is the expert psychiatrist. She's recruited, I don't know, 30 or 40 psychiatrists. She's really in tune with her mental health vacancies. Anaesthetists. Interestingly, there's no active vacancies in New Zealand at the moment for anaesthetists, but this will change.
Okay. Cardiac sonographers, I believe you mentioned.
Yes, yep. Sonographers. Sonographers are a tricky one. You have to get your registration in that scope of practice. So that's the sort of thing we'd have a look at your CV and talk to the registration board.
Fantastic. ICU nurses?
Yes.
Mental health? So
yes.
counselling, nursing,
yes.
all of that?
Yeah. Mental health nurses, yes. Counsellors is not something that we recruit directly. You'd have to have a bachelor's in nursing or a diploma in nursing and experience within the mental health sector.
GPs, yes, of course.
Yes, big yes for GPs.
Pediatricians?
Yes, pediatricians, yes.
Clinical psychologists?
Yes.
Okay, awesome. So it's pretty much a yes for everyone, isn't it?
But pretty much. And look, if there was an area, for example, a medical lab technician or a clinical coder, something that we don't recruit often, we can still give you lots of information and send you websites and links and interview tips and tricks and CV formats to help out as well.
Okay. Now, a few people are fresh out of school and it can be in a wide range of health occupations. how likely is a district health board or a New Zealand employer, or is that even a barrier to registration for those junior professionals to come to New Zealand?
Yeah, I'll just say yes to ENT. I've seen at ENT we have a couple of otolaryngologist positions that we've been asked to fill. So David, please make contact. With regards to recent experience, it will depend on the person. If, for example, a nurse has worked as a healthcare assistant for many years, or a lab technician, or within a health-related field, we will look at that CV carefully. However, you need 2 years experience to gain registration in most fields. So 2 years experience as a registered nurse, as an anaesthetic technician. Generally, OTs and physios, we can look at their CV, but perhaps 1 year, but you do usually need experience post-graduation. And as I said, if you didn't hear the beginning of this webinar, we're a free service, but we do work exclusively with you. So we ask that you just work with one agency and one employer at a time. New Zealand's such a small place that you don't want to send your CV to too many employers.
Thank you, Prudence. I've had a few more private questions regarding health concerns for a family member and how this may impact the migration. For any of these, I suggest you reach out to us directly at New Zealand Shores so we can talk through the actual medical concern and see how much of an impact this might have on your plans. So I'll be replying privately to all of you with my email address, and then we can talk through the circumstances. People have asked also can the partner join even if they're not in the medical field? Well, yes, of course. It doesn't have any bearing on the ability for the family to tag along. If you do secure a role in New Zealand as a health practitioner, you can bring your partner and dependent children as long as we can prove the relationship. Something a bit besides the topic of work and registration for you, Charlotte. People were asking about study rights for their children once they come in New Zealand. Can they go straight to school, or do they need to be on a different visa? Do they have to pay anything for school?
Yeah, so I'll just quickly talk over both your rights to healthcare and your rights for your children to attend school. So just going off your question, Fabian, schooling, for everyone in this webinar, because you are highly skilled professionals with highly skilled job offers, your children would be able to attend school, either early childhood education or primary, secondary, high school on arrival. There is some charges attached to early childhood, so that isn't a form of subsidised education in New Zealand. Even as New Zealand citizens, we do pay for that. Once a child is 3, though, there are, I think it's 20 hours per week. Sorry, I don't have kids, so I'm 100% not the expert on that, but I believe it's 23 hours. So effectively half of your week would be subsidised by the government. Once your children are at school level, so primary, intermediate, secondary, schooling is effectively free. In New Zealand, if your child attends a public school, you pay a school donation. I understand that can range from sort of like $100 to $200 roughly, and that depends on the school. So some schools get more funding from the government from others, so that's why I think there is a bit of a difference there. But that's effectively what you pay. You don't pay thousands of dollars. You do pay for your children to go on things like school camps or extracurricular activities, but in its essence, education is free in New Zealand, and that applies basically from age 5 right up until age 18, so last year of high school. In terms of healthcare, as a migrant, the minute you are granted either an essential skills work visa or a work to residence work visa, or that new type of work visa that we're expecting in the middle of the year, you will be entitled to free healthcare. So GP visits are subsidised. You pay somewhere between $20 to $50, I think. And once again, some clinics get more funding than others. But if you're in an accident or you're sick and you need to go to hospital and you need treatment, that's free. It's all paid for by the government. Some people choose to take out private health insurance, but ultimately you don't actually have to have private health insurance in order to get treated.
Cool. Thanks, Charlotte. Yeah, I mean, moving to New Zealand is obviously a major undertaking for a family, and it does come at a cost, but depending where you are in the world, you may end up not having to pay for healthcare, which could be a substantial part of your monthly budget for a family currently. Same goes for school. This is also a saving in that front. Do we find a job first or do we get licensed first? Well, the recommendation is to obviously look into occupational registration as a very first step, and start working on your other documentation on the side. Can you talk through the extent of the support you might be able to provide at Accent regarding registration?
Yep. Thanks, Fabian. So with regards to registration support, we give you all the support no charge. All occupations will need registration in New Zealand prior to interview. Apart from doctors, doctors need to have a job offer first before they gain registration in New Zealand. So doctors need a job offer first in most cases. Physios, OTs, nurses, anaesthetic technicians, all the other medical professionals, we can send you a link for the registration with all the instructions. So if you email info@accent.net.nz and say registration, midwife, information please, or physio registration information please, we can then send you the information pretty quickly on information on the registration process. Generally, you need a CV, a transcript of your training, copy of your license from where you did your where you are registered, references, and Accent can help with those that information that you need, copies of ID, and further documentation as per the information. The physios need quite an extensive portfolio. With regards timing, you also may need a police clearance or a fit to work. But with regards timing, a nursing registration takes about 6 months. Anaesthetic technician registration takes about 10 days. Physio and OT registration takes about 4 to 6 months. So you really do need to prepare in advance. And if you're a surgeon or an anaesthetist or psychiatrist, we can take you through that process as well. You will need to do identification with the EPIC, which is the electronic portfolio identification and credentialing, or the CG FNS, which nurses will be familiar with. So we can send you all those links in a signature, which is quite quick.
Fantastic. Thanks, Prudence. You mentioned some registration processes can take up to 4 to 6 months. It's probably a good idea, in your best interest, as you engage with Accent and work through the registration process, to engage with New Zealand Shores, or if you want to do it yourself, regardless, start working on your other documentation. There will be a vast amount of documentation needed for any visas you'll be applying for, whether the critical purpose, the temporary work visas, or pathways to residence. We'll have to look into your partnership evidence, make sure your passports are up to date. Have you got your unabridged birth certificate yet? This can take a while to obtain from certain countries and will be absolutely necessary for residents. Your partnership evidence, work references, qualifications, there might be some other kinds of assessments involved as well. So all of this can take time. We talked about, Prudence, we talked about job opportunities by occupation. What about regional variations? Is there demand all across New Zealand? Some people really want to work in remote rural areas as opposed to big cities. What's your experience with this?
Yeah, that's a very common question. So again, New Zealand, we have positions up in Northland, Whangarei, Auckland, Rotorua, Wellington, all the regions, the large Auckland, Wellington, Christchurch, Tauranga regions, depending on your occupation. Plus, we've got positions in the smaller areas on the west coast of the South Island. We've got positions down in Invercargill, which is a fabulous place. So there are positions throughout New Zealand. They do vary. At the moment, we could place a physio and an OT anywhere in New Zealand, a midwife anywhere in New Zealand, a theatre nurse anywhere in New Zealand, psychiatric nurse. There's a common theme there that's always a demand. If, for example, you're a radiographer or sonographer, there might not be an opportunity for a therapeutic radiographer at all times, but you just have to be patient, be prepared. get the paperwork going. So it's about patience, preparation, and being prepared.
Right. So another very interesting question that actually never occurred to me, but the registration process involves quite a bit. But once you've got over that, how long is that valid for, or does that vary depending on the occupation?
It may vary depending on the occupation. If you get registered, you're registered for life. So I'm still registered as a nurse, but I haven't got an annual practicing certificate because I haven't practiced for so many years, many years. But once you're registered for life, and you can keep it as a silent registration.
Okay, so what you need is a practicing certificate on the side.
Yes.
For every year you practice.
Yeah. Yep, and so you apply for your registration. That can take 4 to 6 months to apply for it, and then you get your practicing certificate about a week before you're ready to start work. And you need a practicing certificate to start work in New Zealand.
Okay, what's your experience with American qualifications? Are these usually easy to get registration through? I'm talking psychiatrists or GPs.
Yes and yes, psychiatrists and GPs are both very easy to get registration. The Medical Council takes 20 working days to get registration. So the Medical Council for doctors is pretty quick. For, what was the other occupation you said? Sorry, psychiatrists and GPs. Yeah. GPs takes 20 working days. So our timeline, which is off a common question, is we'll get your CV, we'll reference check. That might take 10 days. We'll get you an interview, 10 days. Get your registration, 20 days, your visa, 20 days. So all up around 60 days or 2 months from start to finish. And we often work with people for six years before they're ready to make the move, before they're ready to have their children in their home country and sell their house and come over and finish working in their home country. Some people can take as short as 3 weeks and 2 days to get here from start to finish. That was a pretty rushed recruitment process, but both the employer and the employee were on board to get here quickly. Other people take, usually we say it's a bit like having a child, 9 months.
9 months, right, okay. Charlotte, someone's asking whether they can, someone's asking whether they can come to New Zealand without a job offer as long as they're licensed. Is that an option? Has it always been an option at any point?
It has been an option prior to COVID. So we used to have plenty of clients who would, decide, hey, I think I'm interested in migrating to New Zealand. I might go check the place out for a couple of weeks on holiday and then head home and make my mind up. So that was quite common prior to COVID. Now with COVID in place and that really highly restricted border, it is of course a whole lot more difficult. So at the moment, absolutely, you need a job offer before you can enter the country. Even if you hold registration, you still need a job offer before the government will grant you a visa. As we start to see our population be vaccinated and we start to see those border restrictions ease and change, those job search trips or those investigation trips will absolutely become an option again. But right now, and probably till the end of this year, you're going to need a job offer first.
Okay, job offer first, noted. We've seen some concerns with people who started the process and quickly realized that they're essentially moving halfway across the world with only a 6 months visa. So you can understand the concern of long-term planning. Is that going to be enough time for me to secure another visa after that? Do I have a pathway to residence at all? What can you tell us about your experience on this, Charlotte?
Yeah, absolutely. So I can see how it would be a bit scary arriving into a country with only a 6 month visa. What we do is the minute someone arrives into the country, we effectively apply for those either essential skills visas or work to resident visas straight away. And obviously, in addition to that, your partner, if you have one, would get a partnership work visa, and your children would get student visas or visitor visas. The moment they're processing really quickly. So I guess the bonus for everyone in this webinar is COVID has meant less applications sitting with immigration. So everyone's visas are processing in about 2 to 4 weeks. And honestly, it's closer to the 2 than the 4 at the moment. Pre-COVID, everyone was really waiting. Well, not everyone, but a good proportion of people were waiting closer to 6, sometimes up to 8 weeks. So our goal as an advisor at the moment is we really want to get those visas, those work visas submitted within a day or two of you arriving. So hopefully we use the most of your time in managed isolation for processing with immigration, and then those next set of visas might be approved, only a week or so after you've left MIQ. So yeah, you will get a visa for a longer duration. You just have to trust the process and make sure that you take each step.
Hence the benefit with working with experienced recruiters who know how to get you here quickly, and experienced licensed advisors to make sure the applications, whichever they might be, are properly prepared and in good hands. Another question: how to best present yourself on an application? I suppose it really about conveying to your potential employer that you're prepared, you know the requirements, you're curious, you're willing to learn. What's your experience with this, Prudence?
Yeah, look, we can send you a CV template. So again, if you email info@accent.net.nz, put CV template, please, we can send that straight back to you. So you want to present your CV in a slightly different way. It's shorter than a UK CV and longer than a USA resume, for example. So it's usually about 6 pages, and it discusses things like, you're working at London's Great Ormond Street Hospital. Of course we all know about it, but let's hear about the population of patients, the specialties, how many kids you look after, what sort of allied health you work alongside. So we want to know a little bit about the hospital you're working at. We want to know your motivation to come to New Zealand. We want to know your reason for leaving each role, and just a little bit more about you. And we can send you a template. So if you email info@accent.net.nz, we can send you the template of the CV, which is really, really, really important. And the employers really like it, that the template is just the same. And it has similar information, and there's consistency, and it just discusses a little bit more about you in more detail than you might have on a local CV.
Great, thanks, Prudence. Planning very long term, I have a question there. What's the likelihood of citizenship after the visa? It's a completely different matter. In order to become a New Zealand citizen, you need to have lived in New Zealand as a resident. So first you need to come in on the work visa and then secure residence. Then you need to live in New Zealand as a New Zealand resident for 5 years, and you need to live here for at least 8 months per year throughout those 5 years. And then you can make an application for citizenship, which is not actually to Immigration New Zealand, it's to the Department of Internal Affairs. If you're interested in citizenship, you might want to check whether your country of origin allows dual citizenship as well. In some cases, you might have to renounce your home passport in order to become a New Zealand citizen. But as far as New Zealand's concerned, they do allow dual citizenship. All right. Thanks a lot, guys. Is there anything else you'd like to say to assist our prospective migrants? Where to start the process? Turning to you, perhaps, Prudence, what's the next step?
Look, the first step is to get your CV to us. We'll send you a template so it can be formatted the way that we like it for New Zealand. We'll send you information on the registration. One thing perhaps to discuss at this stage is references. Now, you might not want to discuss your plans to come to New Zealand with your current manager or your current colleagues. There are ways around that. But it's really important when we do get to the reference checking stage that we do the reference checking in a certain way, and we need that information from you. But, New Zealand's very buoyant at the moment. It's an amazing place to be, that we can have concerts and lots of outdoor gatherings despite COVID. The price that you will pay to help keep New Zealand safe is isolating on arrival. And you may have to budget to pay for that. Some employers may pay, some may not, but it is quite a significant amount, between $3,000 and $5,000 to isolate, and that's New Zealand dollars. So some employers will pay, as we said. We're looking after New Zealand. You'll get a great orientation. We've got some really awesome feedback on our Facebook page, which we'll put up, and sort of some case studies on our Accent website. But it's a really great place to be, and we are busy, but not too busy to help you out. You should find that you'll hear back from us within 24 hours. and we can start the ball rolling.
What about you, Charlotte? What's the next step from your perspective if I wanted to come to New Zealand?
Yeah, next step would absolutely be getting in touch with us for, firstly, an eligibility assessment. So, you know, there's a 99.9% chance that if you're in this webinar and you're a healthcare worker that you are eligible to migrate, but obviously we absolutely want to check that. So I believe, Fabian, you might be sending some information out about that afterwards, but please correct me if I'm wrong. Otherwise, you can also connect with us through Facebook or there through our website. We have an email address, which is health@newzealandshores.com. I'll drop that down in one of the boxes here somewhere. Sorry, I'm not a Zoom expert. That does actually come directly to me. So if you email health@newzealandshores, you will be getting a response from me. So yeah, please reach out, ask any questions you have. We can offer free eligibility assessments, and then we can offer free follow-up Zoom consultations as well.
Like Charlotte said, if you haven't received an eligibility assessment from New Zealand Shores yet, please request one. You can either email health@newzealandshores.com or fabian@newzealandshores.com. I have been in touch with most of you. The assessment is a very valuable tool to get an idea of the process, to get clarity on your eligibility, and also see what's involved cost-wise, the price of visa, and essentially what you can expect. Thanks again, everyone, for attending. This will be recorded and sent out to everyone as a reference, and we look forward to the next one. Thanks, Prudence. Thanks, Charlotte.
Awesome. Thank you.